The Chesapeake Thrives Behavioral Health Work Group consists of over 25 partners from public, private organizations, and this includes nonprofits, mental health providers, medical providers, peer services, military, schools, you name it, we got it. And it's really important because we all support each other in our group projects initiatives and also in our individual projects and initiatives. And it's really great to have a discussion once a month when we meet to talk about what we're seeing in our community. Because what one partner may see may not be what me and my team is seeing in the community. And that way, when we have these really important discussions, it can help us tailor our projects and initiatives to what our community is needing at the time. So it takes a village, and our Behavioral Health Thrives work group is really meeting that challenge and showing that it works.
I became fascinated with the mind and human behavior at a very young age. From my own experiences with mental health kind of steered me towards the behavioral health field. Initially, I wanted to work with adults, but after volunteering with CASA as part of my graduate program, I realized I really wanted to work with children and teens. Kempsell Center for Behavioral Health is a pediatric mental health facility located in Norfolk, serving all of Hampton Roads and the state of Virginia. We have 3 lines of service. Our acute crisis stabilization program is a 48-bed unit for children 4 to 18 that are experiencing a mental health crisis. Our residential program is a 58-bed unit for adolescents and teens 11 to 17 years old experiencing long-standing behavioral concerns. Branches, a service of Kempsell Center for Behavioral Health, is our partial hospitalization program, which is a 5-day-a-week outpatient program for children and teens 8 to 18. It can be utilized as a standalone program for children that may need a higher level of care than traditional outpatient therapy, or it can be used as a step down from one of our inpatient programs. We also provide free mental health crisis assessments or level care assessments at no cost to families 24/7. Families can call, make same-day appointments, or are always welcome to walk in. I truly, truly believe everyone is here for a reason and everyone has a purpose, and we need you here to fulfill that purpose, and that goes for patients and providers.
So we know that about 70% of eligible veterans live on the south side. Our hope is that by accessing care where the veterans live and work, that will improve that access to care. Help is available. You are not alone. We are here to support you. We know that our veterans and our military community and the caregivers, oftentimes those are the folks who are the first to offer help to anybody around them and their support in their communities. We've had an outpatient, community-based outpatient clinic, or CBOC, in Chesapeake for some time now. However, the new North Battlefield multi-specialty CBOC offers an even broader set of comprehensive outpatient services, including but not limited to primary care and diagnostic imaging service, pain management, neurology, and pharmacy. From a mental health standpoint, North Battlefield also has outpatient mental health and substance use clinics, mental health intensive case management, trauma recovery services, a suicide prevention team, and the Connect Clinic, which provides walk-in mental health services for veterans wanting to be connected to a mental health team. We want to make sure that those veterans and those caregivers and the family members are also getting the care that they need. So by accessing care, 988, the Veterans Crisis Line, there's a website, Don't Wait, Reach Out, that has lots of resources available. And of course, the Chesapeake Behavioral Health Team has been an integral part of working together in collaboration.
I'm a volunteer with NAMI Coastal Virginia. I am the board president and the youth and young adult outreach coordinator. In December of 2015, our oldest, our daughter, who was in the middle of her second year at college, she experienced her first manic break and was hospitalized. And we didn't know what to expect when she was going to be discharged. So a family, actually a friend, suggested that we take a class with NAMI, the family-to-family educational class. It was just a huge help for us and eye-opening. And then once my daughter was stable in her recovery, I started volunteering maybe an hour or two, just answering the phones in the office. So NAMI is the National Alliance on Mental Illness, and it is the nation's largest grassroots mental health organization that's dedicated to bettering the millions of lives that are affected by mental health conditions. So that is unique. And another factor that's unique to NAMI is that all of the facilitators of the classes, the support groups, the presentations, they all have the lived experience, that lived experience being either that they themselves live with a mental health condition or that they have a family member who's living with a mental health condition. NAMI breaks down the stigma surrounding having a mental health condition every day with our educational programs and just sharing the facts about mental illness. It helps people to realize that mental illness is common. It's more common than people think. So we help break down the stigma every day.
Well, stigma is harmful, negative, inaccurate stereotypes against either mental illness or those who deal with mental illness. And so it can take a lot of forms and be very harmful. For instance, people who are suicidal can be called selfish or cowardly for feeling that way. People with depression can be called lazy and that they just need to pull themselves up and try harder. People who have schizophrenia many times are told that they're violent. And that can be external. It can come from family and friends and just society in general. And it's even worse when it becomes internalized. Like, I know I'm a peer and that means that I have mental illness, and that message about myself became internalized, and I truly believed that I was a burden on everyone, that I was weak, that I was lazy, that I wasn't worthy of help. And mental health stigma often keeps people who need help the most from getting that very help because they don't believe that they're worthy of getting that help. At Chesapeake Integrated Behavioral Health Care, our goal is to meet people where they are, reduce barriers to recovery and care, and to help individuals build a healthier, more hopeful future.
Chesapeake Integrated Behavioral Health Care is truly committed to helping anyone in our community who needs a little mental health support, who's experiencing some substance use issues, or has a developmental disability. And we really have a wide array of services that we offer. We really are the one-stop shop. We have case management, we have an intermediate care facility, we have day inclusion and support programs if you have a developmental disability. If you have a substance use challenge, we have office-based addiction treatment, we have a pharmacy on site, and we also have unique services if someone is experiencing chronic homelessness and has a serious mental illness.